Welcome back, everyone. This is Paige from NextGEN NCLEX Reviews. Today we're going to quickly go over a highlight table question. You might see a question formatted like this on your NextGEN NCLEX exam, and it's a great idea to go ahead and get familiar with how these questions work and how they're scored before exam day, which is right around the corner. So with highlight table questions, you're going to be presented with a chart or a table. It might be physical exam findings, it could be laboratory data. It could ask you something along the lines of which assessment findings require immediate action or intervention from the registered nurse, or they might ask which lab results require follow-up from the registered nurse. These are just some examples of the types of questions you might be asked, so please do be sure to read the question stem for each question. You're simply going to use your mouse, move over the cells of the table, and click in order to highlight. They're going to make the highlightable areas very clear, very obvious to you. So basically just move through these questions methodically and systematically. What is it asking you? Does this require intervention? Does this require follow-up? Whatever it is, look at each cell, answer that question yes or no, and move right along. So each question will have a maximum of 10 options for you to click, and you can select and unselect if you change your mind or if you accidentally click on an option. Just remember that once you submit the question, you cannot go back. As for scoring for this type of question, you will receive 1 point for every correct choice you highlight and subtract 1 point for every incorrect answer. Partial credit, my friends. We love to see it, right? The lowest score that you can receive is a 0, so it's not going to deduct points from your overall score if you completely miss one of these. But as you can see from this type of question, every point counts. Give it your best shot. Even if you don't get things perfect on one of these questions, you can still gain points towards that overall score that you're shooting for. Now let's go ahead and dive into our practice question. Here is your table. So the question is asking, the registered nurse working on the medical surgical floor is reviewing lab results for a client who is prescribed furosemide. Highlight the findings that require follow-up from the registered nurse. Now, I know there is a lot going on this screen, so I want you to go ahead and pause the video, select your rows to highlight for follow-up, and then go ahead and press play when you are ready. Hopefully you had a chance to look things over. Here are your answers. Is this what you were thinking? Let's go ahead and talk each one of these through. So remember when we talked about taking these questions row by row? Let's do it. So first off, our glucose. This is barely over our reference range that you see there. Not super concerning at this time. If a client is on a loop diuretic like furosemide or really any diuretic, we do need to go ahead and keep an eye on that glucose level, as diuretics are known to sometimes cause hyperglycemia, drive up that sugar. Remember, just because something is slightly out of reference range, it doesn't mean that you need to follow up or notify the provider immediately at that time. Next up, we have calcium looking great and within range, so let's just move right along. Now that brings us to sodium. What do we remember about electrolyte imbalances and furosemide? Do you remember that this medication, it's going to cause depletion of sodium, potassium, calcium, and magnesium, so it's not uncommon to see all of these affected together at the same time. Also, the rapid diuresis that we're going to see with furosemide, it can cause dehydration. So these are things to keep in mind anytime you see furosemide in a question and in the care of your clients someday. So that sodium is low, and we know that this medication is only going to increase the wasting of sodium as time goes on, so we would highlight that. Same story with potassium. If that potassium continues to trend down, our client can then end up with life-threatening arrhythmias. So yep, we're going to go ahead and highlight that also. So then we have our carbon dioxide and our chloride. They're still looking okay. What about that blood urea nitrogen, or BUN? So as we said before, furosemide, it can cause dehydration. It can drive up that BUN and creatinine, which are our kidney function tests. Creatinine is looking okay still, but that BUN makes us think that our client might be a little bit dry or dehydrated. There might be other factors at play with this client, like a history of kidney disease, but given the little information that we have in this scenario, we would certainly want to go ahead and follow up on the blood urea nitrogen at this time. And there you have it. So just a little fun bonus information before we close out on the topic of loop diuretics. You're going to see loop diuretics like furosemide prescribed a lot in which cardiovascular condition? Can you think of it? It's heart failure. Furosemide works fast. It pulls off that extra fluid in our volume overloaded conditions. Now let's tie that in with a quick little physical assessment review. Let's say we're assessing a client with heart failure. What might we expect to hear upon auscultation if there was fluid volume overload? We would hear crackles, which can signify fluid in the lungs, and we might also hear an S3 heart sound. Thank you so much for joining today. Keep up the good work in your studies. We are all rooting for you, and please be sure to go ahead and hit subscribe so you don't miss out on our next video. Happy studying!